the president of Mercy One Siouxland Medical Center, as well as Lynn Wold, the president and CEO of Unity Point St. Luke's. I will turn it over to Kevin. Thank you.
Thank you, Rebecca. Kevin Green, Director at Sun District Health Department. Our role in a lot of this was getting some things going as far as response, but I think right now one of the key positions that we're in is we're looking at sharing the data of the impact of the COVID-19 virus on Woodbury County. And I think one of the introduction of data points we introduced last week was related to two indicators. One was the percentage of positive tests, of all those tests done for Woodbury County residents, what percentage is positive, and the other part is the newly confirmed cases within a week. And the reason why we need to do more than one data point is just as we experienced in the last week, we did have somewhat of a reduction in the number of overall tests done for Woodbury County residents, and that's probably more relative to the holiday weekend. And we didn't have quite the capacity at that point in time because Sioux Community Health Center was not running their community clinic, but there was still testing going on within the community. And I think one of the things that we look at with this is we're really looking to identify about trends that are in 2-week increments. And when we see trends going in the correct direction, it means that our residents are responding appropriately and we're able to manage somewhat the COVID-19 within Woodbury County. What I'm happy to present this week is that last week we were at about 17% of our total tests done that came back positive. This week that has gone down to 13%. So we're saying that is within a positive trend, but we're really feeling a leveling off of some of the things that are going on. Now, one of the things I need to acknowledge, because all of our data and all of our behaviors are affected upon what sort of implications come about as far as any previous restrictions. And related to some of those restrictions for mobility, attendance at different things, the governor has opened up most items of business. They want to get the economy back on track. We will not know for sure the true impact of that in our numbers until probably later next week, because anybody that has now gone out and begun to participate in these group activities, it takes a while for the symptoms to develop, the medical provider to go through, the testing to be done, those types of things. And we'd look at probably in our test results seeing, is there been any increase? And the other indicator we've also looked at is that of the newly confirmed cases. And of course, the reason why we do the dual or two indicators is we also know if there's less testing done, the likelihood of fewer confirmed cases is probably probable also. So we take a look at those and we look at the numbers, and that's what we're trying to monitor. What we do is we share this out with some of our local elected leaders. We want to support them in some of their decisions they're doing, and they need to get an idea of what's transpiring within the community. Also then, with the testing rate in Woodbury County, the hospitals are both here. They both have a network of clinics, community health center. We have constantly talked about the partners that are providing testing in our community. One of the things that we keep monitoring, because I think we have to claim this as a success, is the fact that we are actually number one in the state of the percentage of residents that have been tested for COVID-19. According to the top 20 counties, we have about 11.5% of our residents that have all been tested. And this has come through a variety of measures. One of the things that was voiced as a concern in previous weeks was the fact when Test Iowa moved out of Sioux City and went to alternate locations. As we said last week, they did about 718 tests the time period that they're here. In the meantime, we did over 12,000. So I think what we're looking at is we're still continuing. We're looking at that. We want to make sure that testing is available to residents that need it, because we need to get those positives identified so we can support them in recovering. And I think that's what's important to us as a public health agency and also as a community. So no further comments at this point. I'll turn it over to Beth Hughes, the president of the Western Iowa Region, Mercy One.
Thank you, Kevin. First, I'd like to take an opportunity to thank the Siouxland community for your tremendous support of our health system. We have received over $20,000 worth of PPE, countless meals and treats, as well as many, many well wishes from all of you. From the many of you who spent hours sewing masks for all of us, and the local young man who 3D prints face shields for us, bless you. Every gift, every message of support, every snack, every prayer matters to us. So thank you. I also want to thank our 1,500 colleagues, our nurses, our physicians, environmental service workers, lab, case managers, social workers, pharmacists, nutritional support, and many more. You have served this community well. Mercy One has set forth in our mission statement that we will serve as a compassionate healing ministry of Jesus Christ, transforming the healthcare of our communities. We could not deliver on that commitment or even contemplate making it without our talented colleagues. So thank you for living out the true mission of Mercy One. And thank you, all of you who have sacrificed by staying at home, by masking, by physically distancing. Your efforts have slowed the spread, and for that we are grateful. This is, in fact, the greatest way you can show honor to our healthcare workers. I also want to express my condolences for anyone who has lost a loved one due to this terrible virus. My thoughts and my prayers go with you and remain with you. I want you to know that your community hospital is doing well. We are managing the volume of COVID patients. We have the PPE we need, we have the equipment we need, and we have the team members that we need to care for these patients. We've had the benefit of preparing for this pandemic as we watched it sweep across our country. During that time, we gathered equipment, we educated staff, we prepared areas to function differently, we set up testing, and we collaborated with other healthcare organizations. As many of you realize, we have changed the way we do many things at the medical center and our clinics. We paused a number of things that we were doing in order to provide the care for our COVID patients who arrived in Woodbury County. We saw our first case in Woodbury County on March 27th, and since then, between the two hospitals, we've served nearly 400 COVID patients in this community in over 10 counties. You should have confidence in your community hospital's ability to react to your needs. We have stood up COVID ICUs as well as a number of additional COVID medical units, and that can be opened or closed depending on volume. We have equipped and we have trained all of our primary care providers to offer virtual visits so that you can still access your primary care physician and stay at home. So this is our current state. We are testing hundreds of our community members each week through our Fury Clinic, or our Fever Upper Respiratory Infection Clinic at Singing Hills, and we're treating those patients who need a higher level of care at the medical center, and we'll continue to do that as long as needed. Let me just close by saying there's so much hope out there. Last week we celebrated Father Minen being our 111th COVID recovered patient as we celebrated his discharge. Today, before I left the hospital, I learned that we were discharging 6 more COVID patients from the hospital, one of whom was in our ICU, our COVID ICU, for over 40 days. These are the celebrations that we cherish, and we hope to have many more of these celebrations in the next couple of weeks. Thank you. Lynn?
Hello, Lynn Wold with Unity Point Health St. Luke's. I want to thank Beth and Kevin for all that their organizations have done for this community, as well as Siouxland Community Health, Woodbury County Emergency Management. It's truly a great example of how the community has come together and to coordinate and cooperate to deal with something that our country and certainly our community has never seen the likes of before. I am extremely proud of that cooperation, as well as you should be in this community. And I can't begin to tell you how proud I am of our healthcare workers, both in Mercy and the District Health Department and Siouxland Community Health, and certainly at Unity Point Health. What they have done and what we have asked them to do to stand up and battle this coronavirus has been nothing short of fabulous. They have been asked to change process and protocol in so many areas. There's virtually not a single area in the delivery of health care that has not been impacted by caring for this disease, because number one, we want to protect the safety of our healthcare workers and the patients at all time. So we are very fortunate in this community to have the healthcare workers that we do. They have sacrificed countless hours to make this transition, and they continue to do that on a daily basis. We are, we are blessed to have these workers in our community and the way they have stepped up to do this. We currently we are currently serving patients in 2 COVID units in our hospital. We have been doing this all along in terms of having a medical surgical unit and an ICU. Fortunately, this week we are now starting to see our numbers decrease so that we are shrinking the current space that COVID patients are currently located. In the event that we do see an upturn or a spike in cases, we have the ability to go back and open those units. Our hope is that we will not have to, that we can fit in the space that we have to care for those patients. And with that, I would open it up for questions.
We'll start with KCAU. Okay, I have a question for both Mercy and St. Luke's. The first question is, can you kind of talk a little bit about the financial impact this has had on not being able to do elective surgeries? Have the hospitals had to have any cuts in staffing or experience any layoffs?
Yeah, this has certainly had an impact in terms of limiting the amount of normal elective procedures and surgeries that we've done. So it has been a reduction in revenue, and we've made adjustments in expenses and staffing ratios as we've needed to. Obviously, we care for those patients in our COVID units and patients that we have, but we've made the appropriate management adjustments, and it has impacted staff with reduced hours and furloughs.
Are you able to comment on the number of people that have been laid off because of this?
Honestly, I don't have that number off the top of my head. I mean, we're an organization of 1,300 employees, and it's impacted many of the non-direct patient caregivers. Many people have taken a reduction. As an example, many people have taken 1 day off a pay period in an effort for us to reduce our expenses during this time of reduced revenue.
So honestly, I could just say ditto. Mercy One was affected in the same way. Before we started to see our first COVID patient, our volume plummeted in anticipation of this. And so we started this pandemic in a much lower census. And as Lynn said, those things that typically bring the higher level of revenue, those elective procedures, were essentially halted. So its impact on the healthcare industry has been devastating. There's no question about that. We've responded to that very similarly, in fact, identically to the way that Unity Point has, in terms of furloughing some of our non-patient caregivers, having people work at home, and also having people reduce their hours.
And then next question kind of for both of you as well. Can you comment on how many patients are being sent out to Sioux Falls and Omaha, and at what rate?
So I will start with that. Mercy One Siouxland transfers really very few patients out, and through this whole process has not transferred COVID patients out. We're the trauma center, level 2 trauma center, and as such, we're more of the organization that takes patients in from the outlying counties. So we are not full, we've not been full, we have not sent patients out of the hospital. If we turn down a transfer, it typically has to do with the level of ICU, the number of ICU beds that we have in that moment, but it's very rare. And again, we've transferred no patients out as a result of this pandemic.
During the pandemic, we've used a number of methods to manage our patient volumes, and we have transferred out less than 10 at single digits at key times as we manage the safety of the patients, and we look at the units in terms of having a unit that's full versus opening up a new unit. We did selectively transfer out appropriate patients, as we do at any time. We always do what's in the best interest of the patient and the ability of our staff at that given moment to care for patients. So it's been less than 10 that we've transferred out.
And can you talk about the time frame of that? Was it all kind of within the same week, or?
No, it was probably, over a two-week period when we were at our highest numbers, and we were looking at opening a second unit. I know the one time we had 2 or 3 transfers. We needed a 2 to 3 day reprieve before we opened up a new COVID unit, and we just used that as a tool to manage that patient flow.
Okay, and then I just have one last question for you. Are you able to comment at all about kind of the consistent rate of COVID-19 patients staying steady around 70 to 80?
Yeah, I mean, it really has. After that initial surge, mid-April into May, it really has stayed pretty steady. That was the big unknown as to when you looked at that rate of increase during those first 2 weeks, was it going to continue to increase at that rate, or were we going to reach a plateau? And the reality is we reached a plateau, and as some patients would recover and they would be moved down the continuum of care, then we'd have new patients that would fill their spot. So fortunately, you know, anywhere from, it's been holding from 65 to 90 for weeks in terms of the community, what we've been caring for. So that was a fortunate, event that things did reach a plateau and they were in a manageable level, that the community as a whole could take the patients that were new to having had the virus.
Perfect. Thank you both so much. That's it for me.
We'll start with KCAU-TV.
I think one of our first questions is, with having such a big spike in Buena Vista, did you guys have to take on more patients with that, and what did it look like for you guys?
So when that spike started and happened, we took some patients from Buena Vista. We remained ready. I reached out to the president and made sure he understood that we remained ready to care for patients as they saw an increase in their patient population, and we stand ready to do that. But we have received only a couple of patients from them.
Yeah, likewise, St. Luke's, we've received one or two patients from Storm Lake and Buena Vista as well. Again, we are a referral point for the region as well to take patients as needed. Again, it's very situational in terms of if our ICU is near capacity, we may not take outside transfers, but if we have a manageable space in our ICU, then we take patients as we can. So, but we're here to serve the broader Siouxland region beyond the boundaries of Sioux City.
And then I know you guys said you have a decent amount of PPE, but are you guys still accepting? I know there's some groups wanting to donate gowns and stuff. What are you guys asking of the community right now?
Well, certainly we would never turn away folks that want to be part of this effort to help care for patients during COVID-19. Fortunately, we are at a point now where the supply chains have really kind of caught up, and PPE is not anywhere near the concern or the issue it was 8 weeks ago. And we can't say enough about the community, though, earlier in this process, because that was invaluable resources that we received at the time when supply chains were taxed and challenged. So yes, we would gladly take donations at this time, but it is not at a critical level that it was earlier.
Any other questions, KCAV?
That's all for me.
Okay, wonderful.
No, that's all.
KCJ Radio.
Hi, thanks. The question regarding patients on ventilators, then, have you had several patients on them? Are they on them a long time? Just looking for maybe some numbers as far as that level of treatment.
I'll start with that question. The rate of ventilator care in these patients is high. This is a sick population, and unfortunately, Mercy One's experience is that a great number of these patients do go on ventilators. We're fortunate in that we were able to bring in additional ventilators. We're part of the Mercy One system, and as such, we were able to bring ventilators in to help support that increased need in ventilation. But it is, as we have seen across the country, it is one of the increases in care of these patients is ventilation and respiratory support.
Likewise, at Unity Point Health St. Luke's, you know, the intensity of the illness was pretty significant. What we originally thought in the early weeks of planning that this could be an emergency room surge sort of event really turned out to be a critical care event, which is where you use the ventilator. So we have certainly had, early on in the process, acquisition of additional ventilators was key to our process. And fortunately, with our other help in sister hospitals within our system, we were able to acquire additional ventilators to help us at the peak demand, and we have now sent those back. As an example, Fort Dodge has received some of the patients coming out of Storm Lake, and we had 2 or 3 of their ventilators, and then we quickly got those ventilators back over to Fort Dodge when they were starting to see a surge of patients.
Okay, thanks. This has been an illness that has affected people in so many different ways. Obviously, those coming to the hospital are in the most critical needs. Is there an average length of stay time for those? Are most of your patients, are they there a week? Are they there 2 weeks or a couple days? Or?
I would say that there will be at the end of this some average length of stay, but understand that the ICU length of stay is typically higher than we see an ICU length of stay. The days on ventilators are higher than what we would typically see under normal circumstances. We do have a cross-section of patients who are on our medical COVID units who have much lower length of stays. 4, 5, 7 day length of stays is more typical of a patient who's in medically who never reaches the point of having to be in the ICU.
All right, and then I follow up with this because your staff is obviously on the front lines of this, and there are some professions that have lost employees because they've ended up getting COVID-19. Have you been able to keep all your staff protected? Have you had to have people take downtime or go on to quarantine at the hospitals, or very many staff that have had to quarantine or been afflicted with this?
Speaking for Unity Point Health, we have had a number of employees that tested positive for COVID virus, of which we believe 2/3 roughly. To the best of our ability, we think that it was community origin, and maybe 1/3 we feel could have been because of the work that they're doing. So it's a small number in the scope of how many employees we have, and when you think about the contact hours, the number of caregivers and the contact hours that they have with COVID patients, it is a very small percentage that have actually contracted the virus that we can identify as an origin to the fact that they're a caregiver. So certainly it's a big concern going in, but employee safety and appropriate use of PPE is critical. One thing that we've done is we have deployed what we call PPE coaches. And one of the most critical times for staff is when they are taking off their PPE, how they're doing it, what are they touching. So we've used the concept of having a PPE coach or observer help people to make sure when they are what we call doffing or taking off their PPE. That's been a real critical spot for us, and I believe our policies and practices have helped us keep our employee workforce safe.
Any similar occurrence at Mercy then?
So Mercy One's numbers are incredibly low in terms of the numbers of our colleagues who've contracted COVID-19 virus, lower than we had actually anticipated. More really from just a community spread and having loved ones who work in areas where there was a surge in COVID. So incredibly low, and same thing at Unity Point at Mercy One. We have spent an inordinate amount of time making sure that the people who work in these COVID units don and doff PPE in a way that will protect them. And I've done it myself, and it is a very lengthy process, particularly to doff. And it's the, as Lynn said, it's the area in which you are most vulnerable to infecting yourself. And I think there are 26 steps to taking off that PPE. We've spent a great deal of time making sure that our staff has been protected, and they've taken great responsibility to protect themselves and their family members throughout this pandemic.
All right, thanks, both of you.
Do you have any other questions, KCJ?
No?
KWIT.
Yeah, thanks for taking my questions. If you look around Sioux City, it appears that people aren't always wearing their masks now or social distancing. Are you concerned that we could see yet another surge in patients?
I will only say one thing, and I'll turn it over to Kevin. This is what I say. I'm out with the rest of you, and you know, as healthcare workers, we are very concerned. And the one thing I say to people is, you may be over it, but it is not over. And we need to continue to protect ourselves, our family members. And as I said earlier, the best way to protect our healthcare workers is by making sure you're being safe out in the community.
All right, I have a question now for Kevin Green. Woodbury County has reported 37 deaths due to COVID-19. Of those 37 deaths, how many people worked in packing plants?
As far as the 37 deaths, that's not anything that we have tracked back to the place of employment.
Would that be part of your investigation, though?
As far as part of the, there's a contact investigation where we look at employers and that, but that's not anything, we've pulled any of the data out of the data system that exists through the state of Iowa.
All right, thank you.
Any more questions, K-Wit?
No, we're good, thanks.
Iowa Public Radio.
Hey, thank you all for doing this. Lynn with Unity Point, I believe Unity Point started testing all admitted patients for COVID-19 in mid-May. How much of a benefit has that been, and how many more cases has it helped you guys been able to catch?
I do not have the number to tell you how many more cases we've caught, but it is critical knowing whether a patient, you know, going back to May and now going forward, it's critical to understand their status in terms of how they're treated, because again, if they're COVID positive or suspected what we call a PUI, then they are treated as if they have it, and they have to be in a COVID unit with full PPE precautions. So it's a valuable tool as we go forward and begin to do elective non-emergent procedures. Understanding positive COVID and non-positive is critical. It's like any other infectious disease that healthcare delivery deals with all the time. If a person is known to be contagious, we have isolation rooms, and we put people in isolation appropriately to protect them and to protect the healthcare workers.
Got it. And then also for both Lynn and Beth, do the 10 counties that you guys are serving, that you guys have taken COVID-19 patients from, do they include counties in Nebraska and South Dakota? And also, do outside transfers require any sort of extra paperwork or extra process, and what is that?
So yes, they are in our tri-state area is the answer to that question. In terms of the counties that we serve, we've seen patients from all 3 states. There is no additional paperwork or anything that needs to be done. EMS takes great precaution when they move patients in. Now that we have the ability to do rapid tests, it is much easier to understand if we're transferring a patient in who has COVID, and the transport unit, you know, would love that information obviously as well, to be able to protect themselves in the transport process. But it is very similar to the way it's always been in terms of the way we're contacted, our understanding of the medical condition of the patient, and the acceptance of that patient.
And the conference appears to be wrapping up. Key updates for Woodbury County this afternoon. The county now ranks #1 out of the top 20 counties in Iowa affected by COVID-19 for testing rates. Siouxland District Health Director Kevin Green reporting 11.5% of residents in the county have now been tested for COVID-19. Additionally, the percentage of positive cases is starting to level off as well. This week, 13% of tests came back positive. That's compared to 17% of cases just 2 weeks ago. Again, we have the full conference up on our website, that's SiouxlandProud.com. Thank you so much for watching.